What are the risks of chorionic villus sampling, CVS? Imagine getting early answers about your baby's health, but knowing that a procedure might carry some small risks. That's what chorionic villus sampling is all about. It's a test done between about 10 and 14 weeks of pregnancy to check for genetic issues and chromosomal problems. While it offers helpful early information, it's important to understand the possible risks involved. The main concern is miscarriage. There's a small chance, about 1 in 100, that the pregnancy could be lost after the procedure. This risk is slightly higher than with amniocentesis, which is done later in pregnancy. The chance of miscarriage depends on the experience of the healthcare provider and the technique used. Infection is another rare risk. Since CVS involves inserting a needle or catheter through the abdomen or cervix to collect tissue from the placenta, there is a tiny chance of introducing bacteria into the uterus. This could lead to infection, which might require treatment. Some women may experience vaginal bleeding or spotting after the procedure. Usually, it's mild and stops quickly, but heavy bleeding can happen and needs immediate medical attention. There's also a small risk that the amniotic sac could rupture prematurely. If this occurs, it might cause complications in the pregnancy, such as early labor. If the mother is Rh negative and the baby is Rh positive, fetal blood cells could enter her bloodstream during CVS. This can cause Rh sensitization, which might lead to immune reactions. To prevent this, doctors give an injection of Rh immunoglobulin, a medicine that stops the immune response. Performing CVS before 9 weeks of pregnancy has been linked to a higher chance of limb defects in the baby. That's why the test is recommended between 10 and 14 weeks to minimize this risk. Sometimes, the results of CVS are unclear or inaccurate, which happens in about 1% of cases. When this occurs, follow-up testing like amniocentesis may be needed for confirmation. After the procedure, it's important to watch for signs of problems. Heavy bleeding, fluid leaking from the vagina, fever, or contractions should prompt a call to the healthcare provider right away. In the context of family genetic testing and hereditary health, CVS can help identify genetic conditions early. This allows families to prepare emotionally and medically for the future. But it's essential to weigh these benefits against the small risks involved. Always discuss these options with a healthcare provider experienced in prenatal testing to make the best choice for both mother and baby.